So I created a video maybe a year or so ago about one of my favorite artists, Gwen Stefani. I guess it seems like I was defending her in a sense, and a lot of comments stated that maybe I was paid off by one of her agents, to declare that she did not have plastic surgery.
So we're just kind of like, John!
Indeed, there were a lot of people who saw other things than I did as a plastic surgeon, that indeed she had had plastic surgery, and that my vision for Miss Stefani was incorrect. Well, I guess a new video resurfaced of Gwen Stefani in late night TV.
Welcome back to Late Night. We're here with Gwen Stefani.
I can't say when, because this hasn't come out yet, but Blake was like, oh my God, they did your song, and it was...
And she looks apparently almost unrecognizable. Well, here are my thoughts. Hi everybody, I'm Dr. Jonathan Zelken, a board-certified plastic surgeon in Newport Beach, California. I enjoy the art of plastic surgery, and from time to time weighing in on popular theories about celebrities and whether or not plastic surgery is to be thanked or blamed for changes in appearances. One of my most important concepts is that if somebody doesn't admit to plastic surgery, you shouldn't speculate, and you certainly shouldn't say, yes, they did. It's a very private topic, and a lot of people seek plastic surgery to address personal issues and a sense of attractiveness and self-worth that should not be either criticized or discussed if anybody doesn't want to discuss it. And so, in the absence of obvious signs of plastic surgery, we really do need to give these patients or celebrities the benefit of the doubt in these matters. And in my last video, I stated that I don't think that Miss Stefani had plastic surgery and that she's aging gracefully because, first of all, she's not that old, and second of all, her facial structure lends to more favorable aging patterns. There were issues that I noticed, and people were correct in their comments. Indeed, I do think she did have some rhinoplasty at some point, but I was more addressing facial aging and the prospect of a facelift. Now, fast forward 1 or 2 years, we've got this new video and all these tabloids kind of saying, whoa, Miss Stefani's done something crazy, what has she done? And the reason I know about this is because I got a Google alert the other day saying that my Gwen Stefani page on my website has escalated 1,000% in the past week. So I was like, whoa, when that happens, you wonder why. And so I Googled her, and I see that there's, trending articles all over the place about how Gwen Stefani looked unrecognizable. And the snapshots that you see of this woman definitely are surprising, and it doesn't look like her. And it's sort of, it's interesting to look at her because she looks over volumized, her lips look huge. I am not going to say whether or not she's more attractive, but she definitely looks different. And so I want to just take an opportunity, 5 minutes or so, to talk about what I think is going on. And spoiler alert, I don't think she had plastic surgery still, okay? And I'm going to get into it. So a lot of people accuse bad plastic surgery on volumization of the face. A lot of people get fillers. Fillers are omnipresent. They're at every med spa, every street corner. You don't need to be a plastic surgeon to provide fillers. In some states, you don't need to be a doctor or a nurse. Other states, you could be a dentist. I mean, really, everywhere you go, you can get fillers. And so if all you have is a syringe and a filler, I mean, everything looks like it's a candidate for that. I mean, you can do facelifts with fillers. You can do all these things with fillers. But not everybody's a candidate, and there are risks to be considered. My first impression on looking at Gwen Stefani is that she looked like she was 10 years younger, or even younger than that. Her face was very full, very volumized. She had different hairstyle that was very youthful, very shiny. She had very juvenile makeup, juvenile clothing, and she was really pushing her own makeup line on this episode. And I think it's important to understand the influence on hairstyle and makeup on how you look. But I'm not going to say that's all that happened. Let's be honest here. Her face looks different. I see that she has a lot of lip fillers where she didn't have them in the past. And most importantly, the most attractive thing I see is that she has volume in her mid-face. The most unattractive thing I see is that her face simply looks inflamed. So what causes inflammation? I've done my own fair share of fillers, and of course it's the higher profile patients that get sometimes adverse reactions. And one of the adverse reactions I've seen with fillers, especially since the COVID pandemic, and I'm not going to weigh in on that, is that you can have an allergy. You can get an allergic response and get unusual swelling, whether or not you've had a vaccine. I've seen it more now than I've seen in previous years. I've been using different brands of fillers, new emerging products to market and things like that, so I don't know what the cause is. But from time to time, if you look at somebody and they look like they are expertly filled, but something around their eyes looks like they're having an allergic reaction, then sometimes the writing's right there on the wall for you. If you look carefully at both video and snapshots of Gwen Stefani, I think she looks really pretty. I think she looks youthful, but her eyes look swollen shut. And if you look really carefully on the right side, I made a video recently about this so-called Indian band or the Indian dimple that can occur here. A lot of reasons that occurs is you get swelling above and below this retaining ligament that occurs naturally right here. And it gives you this appearance of festoons under your eyes and swelling in your cheeks. And so that's what I'm seeing. I'm seeing a line that forms down her face. I think Miss Stefani was either recently filled, overfilled, or is having an adverse reaction to a filler. That's my thought. This is not plastic surgery, folks. I think she's still beautiful. I think in many ways she looks better than she did before, even with the swelling. But that is what's going on in my expert opinion. If this irritates you, if this resonates with you, please don't hesitate to subscribe, get your notifications, leave a comment below. I am all ears. I find this stuff kind of fascinating. I'm very, very, very for not speculating on patients, but in this case, I don't think she had plastic surgery, which is in alignment with, her own goals and recent news articles about her. But more importantly, I think we should become aware of possible adverse reactions of fillers and what bad fillers or adverse reactions to fillers looks like versus complications of plastic surgery. I could be wrong. These are my thoughts. Leave your comments below. Thank you so much.